Welcome back to the City Current Show. I'm your host, Jeremy Park. We're always honored to bring you inspiring stories of individuals and organizations making a difference and powering the good. And we're honored to be joined by Dr. Julie Gray. She is the Associate Dean for Community-Based Collaboration at Meharry Medical College and also tied to the Community Clinic of Shelbyville and Bedford County, which we're going to talk all about as well. But Dr. Gray, how are you doing?
I'm doing well. How are you today, Jeremy?
Doing very well. So we get to talk about oral health and primary health care and taking care of those in rural counties. So there's a lot to dive into, but let's start with Meharry Medical College. Give us a little bit about Meharry Medical College, and then we'll transition from there.
Sure, absolutely. So Meharry Medical College was founded in 1876, and we are an institution that is made up of the School of Medicine, the School of Dentistry, and the School of Graduate Studies. Our mission is worship of God through service to mankind, and we serve the underserved. We educate. We just matriculated our class of 2022 this past Saturday, and so we transitioned the next group of doctors, dentists, and graduate scientists into the workforce to become the next greatest scientists and educators into our field.
You hear a lot around different areas of specialization like orthopedics, where there's a big shortage of physicians and specialists and doctors coming in. Where do we stand for dentists? What are you seeing for dentists right now?
So right now we are in a great push. We will be increasing our class size for this up and coming year to 75 in dental schools across the country are doing that because as we transition in the next 10 years or so, we've got a population of dentists that will be transitioning out of the workforce. And we are trying to educate as many young doctors, as many young dentists as we possibly can, so that they can go out and serve serve the community. What's so unique about us at Meharry is that our students live out our mission. And when they transition out, they like to go and work in rural areas because as we are committed to our mission, our students and our young doctors are also committed to serving those in those communities. And our students come from not only Tennessee, but all over the United States. And when they go back to some of their homes, some of them stay here, but wherever they go, they tend to serve those that are less fortunate, those that have medically compromised conditions, those with a propensity to diabetes or hypertension.
I think, on your end, when you talk about stepping in, especially to rural counties and taking care of those in underserved communities and making sure that everyone, literally everyone is taken care of, that's the perfect transition to start talking about Community Clinic of Shelbyville and Bedford County. Talk about the clinic overall, and then we'll start diving into the dentistry side.
Sure. So our community clinic at Shelbyville, Bedford County, we see a large gamut of patients that's why we have our partnership, because our patients there are very similar to the patients that we see here at Meharry. Many of them have underlying health concerns. Many of them have been without dental care, have not seen a dentist in years and years. Many of them have systemic diseases. Many of them do not have access to care, and in not having access to care, or maybe not even trusting the dentist, they come to us.
Carry that into the pandemic and what you've seen as a result, because I've got to believe that has also kind of exacerbated the issue with people not coming in on a regular basis. So how has the pandemic impacted the efforts?
Oh, tremendously. So we as dentists were one of the first to not be able to treat patients just on a regular routine basis. So we were only limited to emergency services from probably about March until about May. So many of our preventive, as we would call preventive, standards of care were put on hold. So many of our hygienists were not in the office. So patients got backlogged in terms of coming to receive regular treatment. And so what happened is patients kind of got out of the routine or habit or not even feeling the need to come to the dentist. And so as things opened back up, patients could come in. It was a challenge to get people and patients back on schedule, or even have patients with a comfort zone to come back in to see us. And that is what we experienced, not only here at Meharry, but certainly at our community clinic at Shelbyville in Bedford County. And many of our patients there don't have the resources to come in to see the dentist.
When you look at oral health and how this ties into the importance of primary health care overall, talk about why taking care of your teeth, taking care of your mouth, the oral health, why is that so important to overall health?
For a variety of reasons. So, when a patient does not take care, of their oral health, the ultimate challenge then becomes the loss of teeth. You get periodontal disease, teeth start moving and then you ultimately lose teeth. Then patients have a difficulty chewing their food, digesting their food. Then patients often have a soft diet. They may become diabetic as a result of it, or hypertensive as a result of it. Then that may lead to, kidney malfunctions. So there's so many concerns that you don't think of when you think of neglecting the oral cavity. But overall health is so very vitally important to your oral health, and making sure that you take care of your oral health. And we don't even want to mention heart disease, right? The link between periodontal disease and heart disease.
The other thing I think that is critical, especially now, is it's the self-confidence, but it also too is job opportunities, career opportunities. And so when you think about a smile and what it means, it carries over into every aspect of your life. Talk about kind of that side of,
Sure.
of jobs and opportunities and self-confidence.
Sure. So I'm glad you mentioned that, because I was thinking about that as we were talking earlier. We brought teledentistry because we're there on a limited basis in our Shelbyville clinic. And I had a patient with teledentistry, and he's miraculous. If you could see him now versus when he first came to me, and he was like this. And, he had his mask on, and I said, well, can you take your mask off? And he took his mask off, and then he had his hand. I said, well, I need to look at you. And he said exactly what you just said, which is, I've been behind this mask for so long. I want to go back into the workforce, and I'm uncomfortable about taking this off. And now that I'm going to be going back into the workforce, I need to be able to smile and feel confident about my smile. And that is, what we have been able to deliver to patients is that confidence and feeling good about their smile.
Give me one more thing that you wish everyone knew when you talk about tying it into the community clinic of Shelbyville and Bedford County. Give me one more thing you wish everyone knew about that partnership, that collaboration, the impact you're able to make with the individuals and families that you serve.
I think that I want people to understand that, it takes a village. Not only does it take Meharry Medical College and, the community clinic at Shelbyville and Bedford County, but, it takes, Smile 180. Smile 180 has, been such a tremendous partner for us. And how would we do it without them? Nothing would actually be possible without the equipment, right? Without the dental chair. without the equipment to actually perform the services and ultimately deliver that care and deliver the services to the patients, and the confidence that patients get from the beginning to the end is just priceless and just invaluable. So that whole complete restoration of wellness that patients are able to get is just priceless. And so we are so beyond grateful to our partnership with Smile 180 and Delta Dental of Tennessee. Restoring smiles, I know, is what they do, but without them, it wouldn't be possible.
You mentioned the equipment and having access to all the tools and resources and what that means. Give me one more illustration in terms of Delta Dental of Tennessee and the Smile 180 Foundation, and how that partnership has really helped you impact and serve not only the students, but obviously the individuals and families.
So I think that, our students, rotate, to the clinic, and, as our students meet our patients, and it's a learning opportunity, for our students as well. They're able to see real world dentistry. They're able to see the opportunities that have been afforded in, our clinic there and our other clinic opportunities, but actually see in a training, because we're a training institution, that Smile 180 is restoring lives. And seeing the brand new, equipment there, and it matches, what we've got here at the dental school, is something that is a life-changing experience for patients. And sharing in that joy with patients is something that is just a priceless experience. I can tell you that some of the patients who we have seen in our Shelbyville clinic have come back to us and said that they are more marketable in terms of being able to go into the workforce, and also are able to eat where they've not been able to eat before, and that would not have been possible, without being supported by Smile 180 and our partnership.
How can other companies, individuals, how can the community support your efforts?
I think that the community can support our efforts by making sure to remain engaged, continuing to, we've got to have sustainability for our community clinic at Shelbyville and Bedford County. They continuously need resources. And I think that it's very important as we continue to educate our clinic or our community, that dental services aren't free. I think that that's the number one resounding factor that we've had to really make sure that people really understood over the past year or two. That's been the resounding voice that we've had, is that dental services aren't free, but we have to make people understand the importance of good quality dental care and how important it is for prevention. And if we can get to people early, before a tooth has to be extracted, before we have to get a patient in a partial or a denture, that is what we want. When we talk about Smile 180 and Delta Dental, they give us toothbrushes. We love those. We want to use those. We want to prevent the loss of teeth. We want to use those and come in every 6 months to get our teeth cleaned. We don't want to extract teeth. So that's our lasting resounding message, is prevention of tooth loss, and just educating our patient on coming in for their regular cleanings, and how to prevent getting dental caries, how to prevent getting gum disease, and what to do to prevent having a problem so that we can take care of a problem before it becomes a problem. And making sure that a patient doesn't have to lose teeth, because we would prefer for a patient not to have a denture. We're grateful for the support that we have, but we would much prefer to educate on the front end.
Yeah, I think to your point, the prevention, being proactive on the healthcare side, but then continuing to open access and pour resources in so that everyone, especially when you talk about taking care of those who are living in rural counties, have access, and world-class, top-class care is critically important to making sure that on both sides, we're taking care of our citizens. For you, what's your favorite part of being a dentist? I'm just curious, like what's your favorite part of being a dentist?
I think my favorite part of being a dentist is patient education and knowing that I have made a difference in someone's life. And it just depends on what that difference is. I want to make sure some people have a negative impression of what we are or what they think that we are. Sometimes people are just terrified of the white coat. So it's my calling to make sure that people leave with a sense of trust and a sense of belief in who I am and what I stand for. And I think I do a fairly good job at that, but I don't think that it's enough of that. If it were, I wouldn't have a job, right? But I think that is what I really want to convey. And I really do want people to be educated about what it is that we do and really about prevention, because I don't want to have to do a root canal or do a crown or do something extensive, because that's when we really get a bad rap. That's when, and I'm saying we as dentists, we want to prevent the problem before it happens.
Give us a couple of your top tips. And I think you kind of alluded to it before, is, making sure that you're doing your cleanings and your checkups every 6 months. But what are some of your top tips to be more preventative on that side?
So simple, just, brush a couple of times a day. So morning and night. I tell everybody when I get in front of children, they're like, brush 3 times a day. I said, who brushed at lunchtime? I didn't. Unless you have braces or something, but just brush first thing in the morning when you wake up and last thing at night before you go to bed. Floss your teeth. That's something that's simple. It's challenging for people to floss their teeth. So whatever remaining teeth that you have, floss. If you know that it's not practical for you to floss standing in front of the mirror, keep some floss on your nightstand. That's a practical thing that you could possibly do at night before you go to bed. Floss your teeth. Water. Consume as much water or flavored water as you can, because if you're not drinking high volume sugary drinks, that sugar's not going to stay on your teeth all day long. Follow up with a mouth rinse as well. I didn't mention that when I said brushing and flossing. Those are quick little tips that you can do to help prevent just the buildup of decay. And of course, see your dentist, a couple of times, at least a couple of times a year. The other thing is diet. We all, myself included, have a challenge with food, but if you have a real well-balanced diet, fruit, vegetables, protein, those sorts of things really help with your teeth, and not consuming high volumes of sugary substances. But what circumvents that is to ensure, that you're removing all of that food stuff at the end of the day, right? So to make sure that you do that.
Yeah, great stuff. Great tips. Wrap up with contact information. So website, whatever contact information, how can we get in touch? How can we carry these conversations forward?
Absolutely. So the website to the college is www.mmc.edu. If anybody wants to reach me personally, they can easily reach out to me on my email address, which is jgray@mmc.edu. I'm happy to answer any possible questions that they may have. But we would love to see you at our community clinic in Shelbyville, Bedford County. We're there treating patients today, bi-weekly on Thursdays, and we do teledentistry on the same Tuesday of the day that we see our patients on Thursdays. And any patients that are out there would be happy to take care of you.
Well, Dr. Gray, thank you for all you and your amazing team do. Thank you for coming on the show.
Absolutely. Thank you so much.